COVID vaccines for babies. Florida isn't buying. Hi, everybody. It's Dr. David with another Ask Dr. David video. I have been asked by several reporters in the last 24 hours to comment about the state of Florida's decision to not pre-order the COVID vaccine doses for the youngest children. Every other state in the country has chosen to do so, that assuming that the CDC does, the FDA does accept the recommendation and proceed to authorizing the vaccines to be available for the youngest children. And because of the fact that Florida has not ordered them, there will most likely be a supply chain issue in the state of Florida, as well as at least some delay in giving the vaccine to some families who choose to do that. So I want to break this down a little bit. Now, the state of Florida released a statement. I'm going to quote this here Wednesday, saying that it did not pre-order the vaccines because it did not recommend them for healthy children, which of course was in contraindications to for which they did the same thing for the 5 to 11-year-olds, and of course that was against all the government and the medical society recommendations, and so this is going to fall under the same thing. But today, Governor DeSantis said, speaking at a press conference in Miami, that the vaccines have not gone through enough testing and clinical trials to determine that they are effective, and add that they are least likely to that kids are least likely to suffer serious health consequences from COVID. Now, that's a statement that I think is a truthful statement. There hasn't been enough testing. If you look at the data that was presented for the phase 2, phase 3 trials that the FDA is reviewing, there was a few thousand kids who were a part of this. Maybe, from my rough estimate of the numbers, about 1,000 kids per age being checked for. And of course, we do know that some of the more rare side effects, such as the myocarditis and such as the blood clots for older people, did not show up in the early clinical trials. It was only after hundreds of thousands, millions of people were given it before they were found. Now, there are indications that since 5 to 11-year-olds were less likely to have those myocarditis and blood clotting issues, that the youngest children would also be at risk, but we don't know that for absolute sure, and that's why more numbers. And would I feel more comfortable talking about the safety aspect of this when there's been a million children this age who have been given the vaccine and we've gotten to see what is? Of course I would. Who wouldn't want to see more numbers as opposed to less? And of course, there is this significant question about how much benefit is the vaccine giving to a low risk population. Now, of course, there could be young children who may be bringing it home, or giving it to an older person at risk, and of course, that's an issue. But the governor then went on to say, "I would like to say that we are affirmatively against the COVID vaccine for young kids. These are the people who have zero risk of getting anything." Now, I call bullshit. I'm sorry about that. You want to talk about it being a rare occurrence? Most likely these kids are asymptomatic of having no problems. Absolutely, we all know that that's true. These are people who have a zero risk of getting anything. So no child under 5 years old has ever gotten COVID. There have been children who've died and been hospitalized due to having COVID that were not high risk. So to me, we all are entitled to our opinions. We're not entitled to the facts. And this is a factually absolute incorrect statement to make. But there will be people who will listen to what the government says, and this will be the only piece of information that they may use to check to make their decision. Now, I know many amongst us, we're going to do our research and we're going to look much deeper into these things to really try to weigh the risks versus benefits. But not all people are going to do what we're going to do. And I just think that this is such a drastic overstatement of the reality that I'm sorry, I can't buy this, and I have a problem with making these kind of statements from a position such as what he says. Now, going back to the article that I was interviewed for originally from the Tampa Bay Times, which is linked here. I do want to commend the reporter, because I do think that he did accurately state my position on this. Okay, where I said, I'm disappointed if there is a delay that happens. Any family that feels they should vaccinate their child and get protection, they should have a right to do so once it's been authorized, right? Isn't that what medical choice is about? That's what we are all about. The state of Florida professes that this is a patient rights state. Of course, that's not true when it comes to women's reproductive health, but certainly that's what Florida states it to be. And I would honestly, I commend that the administration has let people such as me be a little bit more broad in the way we treat things. The state of Florida does not have an issue, if properly documented, with using things like ivermectin and hydroxychloroquine. Not that I'm using those things and not that I'm advocating it, but at least it's advocating for patient choice, right? And that's the thing I really want to focus on, because when the state does this, if there is a delay in getting vaccines to the state, in getting vaccines that are authorized into the families, to the families for the children who the family thinks it's right, I think that the state should not be inhibiting this from happening. And that appears to most likely see what happened. Do I think in a few weeks from now it'll probably be all resolved and that people will be able to get it? Sure. But what about people who go to the health department to get a vaccine? That may never happen if the state of Florida isn't having it. Not all doctors' offices get it. And so, again, this is restricting patients' rights, and that's what I think is wrong. So thank you, everybody. Have a great day. Bye-bye.